President Edgar Lungu is committed to ensuring that projects that are currently being constructed countrywide are completed. The head of state has re-emphasized that the developmental journey that government embarked on is for the Zambian people and that all the 10 provinces of the country will receive their fair share of the national cake. One of the sectors where government has recorded a milestone achievement is in health. During his national address in Parliament recently, President Lungu restated that government has constructed over 500 health facilities and recruited over 23,000 health workers since the year 2017 in order to bring health services closer to the people.
In the health sector, my government has constructed over 500 health facilities since 2017. We have also recruited over 23,000 health workers. To ensure efficiency in the supply of drugs and medical supplies, we have established 5 regional medical storage and distribution hubs. Mr. Speaker, as a result of these efforts, more and more of our mothers are now giving birth in health facilities supported by qualified personnel. In addition, our people are now covering less distances to access health services and essential drugs, which are now within their reach because this government cares for everyone. Mr. Speaker, as a pro-poor government, we have an obligation to ensure that the rural population also benefits from the development agenda of the country. I am therefore happy, Mr. Speaker, to report that implementation of the Electricity Service Access Project is going on very well. By the end of 2020, the number of beneficiary households was 29,968, out of which 9,082 were female-headed households. Once completed, 38,296 households in rural areas will have access to electricity.
An effort to achieving primary health care coverage, government, among other projects, launched the construction of 650 health posts throughout the country. As most people, especially in rural areas, were finding it difficult to access primary medical care as health facilities were few and far-flung. Minister of Health Jonas Chanda explained that building health posts and upgrading some clinics into first-level hospitals are in line with government's vision of providing equitable access to cost-effective, quality health care as close as possible to all citizens of Zambia. For sure, government is not only talking the walk, but walking the talk, as a number of clinics have been upgraded into first-level hospitals countrywide. Lusaka district is one such area which has also not been left behind, as some clinics have been upgraded to first-level hospitals, namely Matero, Kanyama, Chipata, Chilenje, and Chawama. The minister was quick to note that Chipata First-Level Hospital was not yet operational, but is optimistic that the health facility will soon be opened to the public as all the necessary requirement yardsticks befitting a first-level hospital, such as a theater, labor wards, and operating rooms, among others, and equipment have been installed.
Again, the president, working with support from various cooperating partners, has brought this huge structure that we have toured, a modern structure. You can go anywhere in Africa, you find you rarely find such good facilities. So the people of Mandevu constituency and the people of Chipata in general, Chipata sub-district has a huge population, catchment, over 500,000 people, are now receiving this very, very nice facility. It has theaters, delivery rooms. The capacity will basically increase. We need also to increase the number of health workers here. So that is why we are saying our government is closing that infrastructure gap that has been there for many, many years in Zambia, not only in the health sector but in other sectors. So we anticipate that the population for Chipata or Mandevu, generally the whole Lusaka and Zambia, will keep on increasing. And by the year 2030, we will be talking about a catchment of probably 1 million people.
To correspond with the construction of these health ports, the ministry will need human resource. Hence, health professionals will be trained and recruited.
We had requested that we recruit another 5,000 or so health workers. But as you say, so we know that we have to balance it up. There are so many needs in the country, but of course health is highly prioritized. So like I said, we are still discussing with Minister of Finance and PSMD, but Public Service Management Division, to see how many health workers will be given to us. But we want many midwives, many nurses, doctors to be employed so that we secure the health of Zambians, especially now that we even have the COVID pandemic. Our workers, health workers are being outstretched. They're working long hours, and we just need to add more health workers.
The Minister of Health appreciated the support being rendered by cooperating partners and individuals who are donating various items to health facilities in a bid to ensure every Zambian has easy access to medical care services.
Yeah, we have a very responsive business community actually in Zambia. I can give you an example. Just 3 weeks ago, in my constituency in Ndola, I was opening a mini hospital built by Indian Petroleum Limited and other companies, and a lot of other partners also put in equipment and all that. So I think with the business partners, what they need is a needs assessment. That's why I'm telling the PhD, the Provincial Health Director, we need to do a needs assessment and then reach them, because they will not know if you don't tell them what you need. How will they know? For example, the issue of mortuary, 450,000 kwacha. If you go to a lot of business partners, that's the thing that they can solve in one day. But if you don't approach them, how will they know? So we need to tell them that we need this. The same applies with the cooperating partners. Just last week, I was writing to all the ambassadors about all our needs, high-tech equipment in the hospitals, the CT scans and all that. But if you don't tell them, how will they know? They will not be guessing. So that's why I'm saying there will be a very active engagement. The Ministry of Health, the private sector, civil society organizations. But that said, a lot of them are very willing to help. But we just need to specify what our needs are.
Apart from Lusaka District, Nakonde District in Muchinga Province is also among the areas benefiting from government's robust health infrastructure developmental agenda. In an effort to supplement government's effort, the business community here was at hand, donating blankets and mattresses to all the health facilities in the district.
We started with Ministry of Education, where we had also covered all schools. We were giving masks and hand sanitizers. Also, we were trying to supplement to the government efforts. We are going to continue helping our government. At the time we'll be opening in Chenga, you will find everything is in place. We will touch even Mipuria, we will touch Movu, we will touch Itundu, even to the ruralist part of the district, they will receive the mattresses.
Mr. Siame notes that government alone cannot achieve universal health coverage without the participation of the business community.
In Nakonde, we have benefited a lot in terms of health sector. There are a number of health posts that our government has built. Hence, as a business community, we need to supplement to the government effort. I'm even appealing to others to come on board, because this is not a one-man show. The government has created an enabling environment for us to do business, and we have to pay back to the community. Hence, I'm standing here to pay back to the community.
The gesture from Mr. Siame delighted the Nakonde District Health Administration.
Very important occasion where we are witnessing the donation of mattresses from Mr. Singo, who is a businessman in Nakonde. Just to mention that this is not the first time that he's making such a donation. I think was it last month when we were receiving mattresses that we distributed to a number of our rural health facilities. And today we're excited to receive this very huge donation. Just to mention that the donation that we're receiving will actually go a long way to improve health care for our patients that we admit in the hospitals. I'm sure you can look at the mattresses. I think they look very good. Patients will be sleeping very comfortably in our wards. And also to assure the district administrative officer who is representing the DC, and indeed Mr. Msingwa, that the donation that we're receiving today will make sure that we account for them and they will be used actually for the intended purpose. We are very happy as a sector because we know that the Ministry of Health alone cannot manage. Therefore, whatever we are receiving to supplement government efforts is very welcome.
The district administration commended the gesture.
We are giving you 40. Then up there, all capacity, meaning the all bed space. Mwenzo will give them 15.
This is the donation that you are receiving from the businessman, Mr. Msingwa. There are 40 mattresses.
Again, we've been gathered by the same man. Again, I think some time back, I was standing here thanking him for the donation of blankets that he made to Nakonde district. There is something peculiar, there is something important about the donations that Mr. Msingwa gives to this district. Something that we should live to actually appreciate. He doesn't just donate to the district hospital. Of course, our cry on behalf of government was that government will not do everything at once. After constructing the hospital, we were told to say this hospital is for Nakonde. And you Nakonde people should actually own it. Unfortunately, there are there are very few people that are actually showing, indicating that they own this hospital. And one person I'll point at is Mr. Msingwa. He shows that he is indigenous here, and he appreciates that this hospital is his. This hospital is ours, and it's a sign that we own it. The ownership is in the hands of the residents of Nakonde.
Patrick Chadwe, village edman kunega. Twapochera ama blankets aya no Msingwa watuletela. Icho tukusalifya vyendi vyo community achakuti asachipepuke ukuwa numuntu wa msango ndivyo noo. Awavule ukula chokupochelela wenda kuika mungu hapa. Lelo muntu waleta ndivyo msango tukatuletela community yonsi nyeswa ntuliwilizizwepa. Asasweswenga ichipatala chisise ndawa mupipi wonga na wamutalinye wakadwala akwizapa. Achino ndivyo sweswe tukusalifya tulipansi ndivyo swebikala kaya wakumwenzoko tukutukanu muntu we ngawangawe wawili watatu chepa mwivintu vyanga vyonjelezi.
Government's commitment to putting up various interventions in the health sector is significantly improving health service delivery in the country through a strengthened primary healthcare approach as a vehicle for advancing universal health coverage.
Tukulosha